Do nose jobs hurt? There is some discomfort with every surgery, and it really depends on the person. I have people that it is more uncomfortable, and then I have people that don't ever take a pain med. For the most part, I would say most of my patients say that it doesn't hurt as much as they thought it would. There is a little bit of discomfort, particularly around where the bones are. It's a little bit sore, and the incision feels stinging for about 24 hours. But most of my patients say it's not that painful, although we do give you pain medications just in case to make sure you're taken care of. How much does a nose job hurt afterwards? It really depends on what's done during that nose job. If you're moving nasal bones, that hurts a little bit more. If you're just doing work on the cartilage, that hurts a little bit less. And it depends on, is this your first surgery, your second surgery, third surgery, and what all has gone on in that nose job. Most of my patients, like I said, do say it hurts less than what they thought it was going to. And personally, when I had my nose job, it felt like sinus pressure. When I would lean down, I could feel the pressure here. I could feel that something had been done. It was sore, but it was not that painful. Do nose jobs age well? This really depends on how the nose job was done. If you did not have as much tip support and we gave you tip support, that is going to age much better than if you had never had surgery. And the way that we're doing surgeries now, we have the knowledge that we didn't have 20 years ago to be able to do this so that it will age very well with you. However, there are nose jobs that were 20 years ago that maybe they didn't age as well. We didn't have the knowledge that we do now, and the way that that was done was maybe without that intent of being able to look good for 20 years. It was to look good today. With nose jobs that were done that way, that they were done 20 years ago, you may see, the dorsum or this part of the nose kind of saddle or get more scooped out over time. The tip rotate up a little bit more over time, or the tip can actually go down over time and you feel like you have more of a bump, just depending on what techniques were used. So it really, really depends, and it depends on who you go to, and it makes it that much more important that you go to someone that does rhinoplasties all the time, and that is a major part of their practice to make sure it does age well with you and you're not 10, 20 years down the line wondering, should I do this again or should I do this a little bit different? Have questions? I help people like you every day and would love to help you as well. Please give us a call.